Good night. My name is Melissa Black, student from Kaiser University, psychology class. Tonight I'll be discussing measuring intelligence in infants and young children. It is very important in understanding children's intellectual ability, as so many children face so many obstacles in life. The content is as follows: history of intelligence, intelligence definitions and theories, assessment and measurements. I'll be discussing a brief IQ assessment, purpose of assessments, ethical and cultural issues faced amongst children. History of intelligence. The measurement of intelligence began during the early 1900s. These testing began especially involving school-age children. The testing began to use in schools, settings, hospital, clinics, courts, prisons, and reformatories. As early as 1985, Alfred Bennett began administering intelligence testing. In 1939, David Wechsler, a clinical psychologist, began measuring adult intelligence. Stanford Bennett, he was one psychologist who looked into measuring cognitive and intellectual disability within children. This test actually helped diagnose many developmental or intellectual differences among children, such as their motor development abilities. Stanford Bennett intelligence scales at first was targeted in regards to adults within the age of 89 years of age and older. It is used for children, as we know, in place, especially within the school system, generally used in intellectual ability and a lot of research and clinical purposes why this test is used. As I discussed, a study that was conducted, it consists of 63 children with autism spectrum disorder. The age range from 3 years of age, 3 months to 16 years of age, 10 months within a mean range of 7 years of age. The study that the children were placed through were full-scale IQ testing. As we know, a lot of individuals feels that a child with autism have a low intellectual functioning. However, throughout this test that was conducted, this begged to differ that it was not so. Yes, some children with autism have intellectual disability with a low IQ score. However, there are some children with autism who are actually very smart, and they like just basic skills, as in terms of interpersonal interaction with people. They like that ability to start a conversation properly. And that's within the autism spectrum disorder within some children versus those who are lower functioning. So there's different function of children in autism. Here we have different types of reasoning in terms of the intelligence testing. Verbal reasonings, quantitative reasonings, abstract visual reasoning, short-term memory, are various different types of reasonings. Intelligence. As we know, intelligence, the definitions has been changing throughout the years. Different theories, different assessments in terms of what's being concluded. As I mentioned before, David Wechsler first began with the Wechsler Adult Intelligence Scale, and known as the WAISS 3. Then it got changed, with him updating to the children as well. We have Rigid 2004 reports Edgar Seguin, an early pioneer in special education in the mid-1800s, suggested that the education of children was in need in focusing on real objectives, sensory stimulation, active engagement, and an emphasis on the child's whole mind, meaning the whole brain of a child, how a child is able to function, their abilities, in better understanding and identifying the cognitive needs of these children. Here we will discuss John Piaget. John Piaget defined intelligence in different stages of a child's developmental stages. Piaget discussed different habits associated with sensory motor intelligence, such as cognition. There are different stages in John Piaget cognitive development stage in children. From ages 0 through 2 is their sensory motor skills, basically touching, sucking their fingers, looking, how they observe things. Object permanence appears around 9 months or so. Between the ages of 2 to 7 years of age, the use of languages, symbols, including letters and numbers, is basically within this developmental stage. Children should be able to do those things. Age 7 through 11 is the concrete operations, where a child is able to understand the meaning of cause and effect in relations to certain things. Just a concrete thinking, able to think at this stage, where they're able to order their level of thinking in terms of what caused something. If this happened, how is this going to affect one? And that's during that age. During the age of 12 and older, the individual demonstrates abstract thinking, including logical thinking, reasoning, and comparison. And this is between the age of 12 and older of children. Here we would discuss David Welsher, as mentioned before, and his discussion of the Welsher intelligence scales for children, which are normally used with children within the ages of 6 to 16 years of age. The WIC-5 measures general intellectual functioning of children and their ability, normally providing a full-scale IQ test. It consists of 4 index scores of verbal comprehension, perceptual reasoning, working memory, and process speed index. Welsher test was first made, as I mentioned, for children, primarily used in clinical setting. This test consists of verbal, nonverbal, as well as performance of children. As I mentioned, I will discuss a brief of IQ. There's different range in IQ scoring. It all depends. This is just a look at different ranges within the Welsher testing. If someone scores 65 and below, it's said that they're deficit intelligence. 66 through 89 is considered borderline intelligence. These numbers actually varies depending on the updates that's been given over the years. I know many of the psychologists use within vocational rehab, their testing ranges from if a child has 59, a score of an IQ of 59 to 7, that means it's borderline intellectual lacking. So it all depends. 80 through 90, dull normal intelligence. 91 through 110, average intelligence, and so on. Measuring intelligence in babies. As I mentioned before, there's different levels in measurements. For babies, for instance, intelligence and their abilities are measured by how an infant is able to lift their heads up, sit up, follow moving objects, eye mobility, reaching for an objects. And that's basic intelligence as babies, to see what their abilities are. The purpose of assessments is primary for documenting, designing, providing, and predicting an intellectual issue amongst a child. Normal assessments is provided within school system in identifying a child's specific learning disability. Disabilities such as reading, math, if a child has dyslexia. Some children have ADHD, making it difficult for them to focus and concentrate in class, and as well as autism as well. in terms of a child with autistic disorder, they face a lot of difficulty in terms of their aspect in completing their work and their cognitive abilities. And achievement and adapting behavior is the main purpose of assessment and helping children. Children memory scale. This is for children 5 years of age and older through the age of 16. It is a comprehension assessment designed in evaluating learning and memory function amongst children. CEMS memory learning function within 3 domains. These are the 3 domains outlined here. There are various issues within faced with administrating intellectual tests. Issues such as cultural biases, language, socioeconomic statuses, and so forth. For instance, if an individual speaks Spanish and the interpreter is not Spanish, it's best practice to actually have someone to interpret the Spanish for that individual, because sometimes the understanding and the outcome of the test gets lost if the results are not interpreted properly. So it's kind of best practice to either have someone in understanding the culture or the nature of it. Here you see black and white distribution in terms of black versus white intellectual disability. According to Brooks, Gunn, and Clabanon and Duncan, 1996, Black children is said to do less within cognitive tests and scores versus white children. And many of those factors, as we know, can fall under socioeconomic status, family poverty. And it's a lot of issues faced amongst children. According to K-News, if a student has an education disability under the Individual Disability Education Act, in order to receive placement and evaluation taken in school, there must be a consent provided by a parent or a legal guardian. Failure to do so, it's not right. It's actually unfair and unethical, as the testing could provide inaccuracy information of that person. There are various ways in terms of avoiding cultural biases. Getting to know the tester background is good. At least you know the aspect of that culture and if that culture plays a role in terms of the outcome of that testing. Consider problems such as medical or family issues that can possibly interpret the test results. Using proper principle standards within the test. It is unethical for any person to administer, interpret, or report testing for he or she is adequately qualified for. The measure of intelligence is the ability to change, as Albert Einstein indicates. Thank you very much for this time in presenting my work. As we know, it is very important in understanding the intellectual ability of children. Children have so much to offer, and how a child thinks, how a child understands themselves, how the world works, and how a person reason and solve problems all contributes to the understanding of a child development. For Piaget, for John Piaget, as mentioned, intelligence could be conceived as a kind of evolving biological adaptation to the world. So basically, when you look at it, intellectual abilities, some of us learn as we get older. And as we grow, our cognitive ability grow along with that. Versus some individual, they lack that ability for their cognitive ability to grow. And that plays into a lot of cognitive problems that they might face. And as mentioned before, it might be an intellectual disability that they have. Their lack of focusing, concentrating, ADHD. There's different diagnoses in terms of what can affect a child and their learning ability. Thank you very much and have a blessed day.